Our early healers didn't have technology at their fingertips, so they relied on a kind ear, a caring touch, and an empathetic voice. With modern medicine, some of that healing touch has gone by the wayside. It's as true today as it was then. Truly relieving a patient's suffering goes beyond the science of medicine. Doctors must also practice the art of healing with open communication and relationship building with patients. This edition of MDGPS provides a practical path to make each office visit a healing experience and why it's important to take the time to do so. A positive patient experience improves health outcomes, reduces lawsuits, and boosts your bottom line. Forming relationships with patients certainly takes more than a single visit, but when patients develop trust and feel safe, they are more accepting of treatment and are more likely to continue care. Just as a white coat and stethoscope inspire confidence as formal symbols of medicine, following a basic patient agenda will foster trust and safety. Even small gestures, like acknowledging each person in the exam room with a handshake or touch, immediately builds rapport. Sit or stand at the patient's eye level and maintain eye contact as you start with a smile and a non-medical question or a personal connection. If they've been in the room longer than 15 minutes, thank them for waiting. Ideally, you'll already have reviewed the history and can use information your team has obtained as a starting point. Listen without interruption. If you need to redirect, gently suggest focusing elsewhere. Computer etiquette, or the lack thereof, speaks volumes. Ask permission to take notes and keep the screen visible to the patient, or at least describe what you're doing. Talking to the screen instead of facing the patient sends the wrong message. During the exam, explaining in plain English what you're seeing, your plan for care, and how results will be given builds trust. Provide reassurance by mentioning normal results. Ask for questions before you wrap up with what will happen next. Have staff review the visit and call the patient with follow-up if necessary. Following this patient agenda will save time, relieve patient anxiety, and reduce your risk of burnout, and build the kind of long-lasting, therapeutic relationships that are the foundation of a positive patient experience.